The Clinical Compass is sponsored in part by Living Waters Health and Mental Wellness and by True North Medical Care.
Hello, everyone, and welcome to the Clinical Compass, where we navigate healthcare through truth and expertise. My name is Chad Stencel. I'm a family nurse practitioner with over 27 years of experience in healthcare. I'm also the founder of True North Medical Care, which is a primary care clinic that focuses on making people feel better and healthier. I'm joined today by my co-host, Jonathan Rohde.
Thanks, Chad. My name is Jonathan Rohde, and I'm a certified nurse practitioner, family nurse practitioner, as well as psychiatric mental health nurse practitioner. I've got over 20 years of experience in healthcare, and I'm the founder of Living Waters Health and Mental Wellness, where it's a place for patients to come to partner with our providers to achieve optimal health. And so we're coming to our viewers today with the Clinical Compass. And Chad, why don't you start us off with why we started the show and where we're going?
Yeah, so I believe our intent to start this talk show was to dampen the noise and the confusion that is out there right now with healthcare and provide education to our viewers to help them navigate the healthcare system.
Right. And so, as you're alluding to, there's a lot of opinions out there, and we want to be more evidence-based and provide that evidence-based information to our viewers. So with that, why don't we jump into our first topic, which is actually primary care?
Yeah, let's dive right into it. So what is primary care? Primary care is basically your healthcare provider that and I hate to say this, but does everything. So they are your go-to person, whether it be for acute illness or injury, preventative medicine, medications, immunizations, those types of things. So primary care is really the gatekeeper.
Yeah.
In healthcare, right?
Yeah, as we were talking, that gatekeeper idea really spoke to me, and it was a nice way to be able to help present the idea of primary care, right? Like, well, what's on the other side of that gate, right? And so it's not meant to be a restrictive thing. It's meant to be, okay, primary caregiver. You reach that primary caregiver, and then they, help you to navigate what's going on based off of your symptoms. Do you need to go to, I don't know, if you have a cough, a pulmonologist, or if you have some nausea or vomiting, do you need to go to a gastroenterologist, right? And so it's not meant to be restrictive. It's more meant to be able to efficiently use the resources we have at the moment within the healthcare system, right? So I really like the idea of partnering as well, right? So it's not restrictive, but it's partnering. Do you remember when you first started in nursing, the primary caregiver actually went to the hospital, right?
Yeah, so it's interesting how over time things have changed. So it used to be your family medicine doctor was also the doctor that was rounding in the hospital on you. So they are the gatekeepers, right? They do everything. And so I want to talk to our viewers about all the services and all the things that a primary care provider can and should be doing. So one of the things that I want to bring up is when you first go to a primary care, in your mind, Jonathan, what should that primary care be doing at the first visit? What does primary care look like, and why should people go to a primary care?
Yeah, so when we're talking about primary care, I think there's a little bit of a disconnect of what the healthcare system believes primary care is and what society believes primary care is. And so when we're talking about primary care, that's not just, oh, I'm going there for an illness or, a symptom. It's, hey, I should go to have a relationship with this person so that they can help me with vaccines, screening tests, those things that help us to be able to catch, potential disease processes before they become a problem, right? And so I guess that's the idea is this primary care person, i.e. it could be a physician, it could be a physician assistant or physician associate, or a nurse practitioner. And that person would be your point person, right? And so as you're going to them, it would be first, hey, I want to start this relationship with this provider, right? The preference would be actually, hey, partner with this person before you're, sick, right? Because, the last time I saw a patient in my own primary care office, we started with vaccines, right? What's something that you think about when you're first thinking about primary care, what primary care can offer our patients?
Yeah, so when I look at primary care, and I've always looked at it this way, you're going to laugh when I use this analogy, but they're kind of like the quarterback with a football team, right? So they're in charge. They're calling the shots. They're calling the plays. So I think we need to tell our viewers, primary care, again, you brought up a valid point. They're not there for when you're sick. They are, of course. They will take care, you and I will take care of everybody's illness. If they're sick, come see Jonathan and I. However, we would rather have people in our office that are not sick. We would rather have people come every 6 months, right, to get vaccines, to get the preventative medicine, to get the preventative tests, immunizations, those types of things so that you can kind of stave off those illnesses.
Or how about even diet, exercise? One of the things that we always talk about is diet and exercise in primary care, right? But we don't talk about it in the context of, hey, I'm just coming to my primary care provider to talk about diet and exercise, right? And so, if you're not out there, exercising, then the question is why? And that's what, we're hoping to do is be able to get, patients out there to their highest function so that they can be doing, the things that we know help them to feel better and stay healthier longer, right?
Yeah, so primary care, again, they're the gatekeepers. They want to keep you healthy. They want to make sure that you're not going to the hospitals, to the emergency rooms, to urgent care. They want to...
If you don't need to.
If you don't need to, yeah.
Right. There's times when you need to, obviously. Called an emergency department for a reason.
For a reason. Yeah, don't go to your primary care if you have a broken arm. We always say go to the ER. But so again, they're that gatekeeper, that first person that is so crucial and so important in the healthcare field because they do so much. I mean, we could sit here and talk for hours about what a primary care provider does because, again, they're that first piece in healthcare that allow you to go down different avenues and see different providers, right? So important.
And like you said, they're the first contact. And as I go back to the gatekeeper mentality, that gatekeeper knows the city that's behind them, right? And so as you go into that city, you're going to want to know, should I take a left or should I take a right? And so that primary care provider does so. So again, this person is there to help you to navigate those steps whenever something goes on. I always tell my patients, I'm a generalist. I know a little bit about a lot of different things. And that's where our specialists come in, is when we identify that there's an issue and I realize, hey, this is a little bit, more serious than I can handle. That's when we gotta, reach out to that specialist and say, hey, I need some help. We're gonna refer you to the specialist and help you to navigate that then, right?
I agree. It's one of those important aspects of healthcare that we can't undermine, right? They're so important. They make so many decisions. Primary care, I don't know if people know this or not, but primary care even deals with, psychiatric and OB/GYN and all of those types of things. So it's really, I call them experts, right? In healthcare field, I call the primary care provider an expert because, again, like you said, they need to know a little about everything. And that's great because they're your first contact. And then it's very important if they only know a little bit about everything, that makes them the gatekeeper because then they know how to send you to the right person, right? And so, again, I've stressed this a couple of different times, but I just feel that the primary care piece of healthcare is so important to not only health and life, but also just navigating the whole healthcare system entirely.
Right. And I guess that then speaks to, if this is that person, then what should you expect when you first go into a primary care office? And what are those, what's the expectation of that primary care provider, right? Yeah. Is it just to get your name and date of birth, or, is it to get a full comprehensive history and figure out what those goals are? Tell me what your thoughts are.
Yeah, so I believe the expectation for a primary care provider is that first line of defense, right? That first contact person. They should be asking you, obviously, name, date of birth for charting purposes, but also allergies, medicines, past medical history, social history. Do you smoke? Do you drink alcohol? Past family history. That's something that a lot of people, I think, blow over is they don't ask about what kind of medical problems are in your family, and that's an important question that we need to ask every patient that comes through. So our viewers should expect that a primary care provider should take the time to really get a comprehensive medical history and really go over all of that information.
Well, I think one of the things that you brought up is the social aspect. Something that we don't think about. I think, or I should say, I think some of my patients have questioned why we would bring up a social history and trying to understand what's going on. But, based off of when you work, the places in which you buy groceries, where you live here in Minnesota, it's hard to get out there and exercise. Obviously not this year, but it's been difficult to exercise. So, it does make a difference, and it influences how we're able to partner with our patients. So, any more on that?
No, I think you hit all aspects of what a patient should expect when you go into your primary care provider. And again, for our viewers, if this is the first time you ever see a primary care provider, they should really be asking you those key questions. What medications do you take? What illnesses have you had? What family history do you have? And they should be spending a good amount of time with you at every visit. We're going to take a short break, and we'll be right back on the Clinical Compass.
Enhance. 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 Too much. Unenhance. Guys, it doesn't have to be this hard. If you want to watch Town Square television programs, just go to townsquare.tv/streaming to find Town Square's community programs and your city or school board meetings. Or look for the Cablecast app on your smart device and search Town Square Television.
I donate to Town Square Television because it's a great chance to be able to be part of your local community, kind of stay in touch and know what's going on and be a good citizen.
It's so hard to get local news now, but Town Square focuses on our 7 communities and whatever's going on in our schools, in our cities, at the county level. There's no better place for local news than Town Square TV.
I just love the things you do, love the things you do.
Welcome back to the Clinical Compass. I'm Chad Stencel, host, joined here by Jonathan Rohde. We were discussing primary care before the break, and I believe we should dive a little bit deeper into where you find a primary care provider.
That's a good question because, I was thinking back for myself even, where would I find a primary care provider? Is it that I Googled a primary care provider? Or is it that I ask somebody that I know or trust? I mean, for myself, it was asking a reliable source.
Yeah, so I don't think there's any wrong in either one, right? I believe that you can get a good primary care provider by word of mouth. I also believe you can go on Google and search your local area for primary care provider offices. I know that for me, a lot of it is kind of word of mouth, right? We get talked about a lot. So, a family member or a neighbor may say, hey, I have a great primary care provider down the road. Does that necessarily mean they're going to be a good primary care provider for you?
That's a great question. And I think that is a good point to ask that question too. What should we come away from? At least in my perspective, my hope is that the primary care provider that I would call my primary care provider would partner with my goals, right? They have the same goals for me that I have, right? And we have that relationship, that back and forth relationship, right? You and I have experienced plenty of times where the patient-provider relationship isn't strong, and that both sides struggle. The patient struggles because they're not really following the recommendations, and then the provider struggles because you're hoping that person is going to get better, but the things that you're asking them to do, they aren't following through with. So that trust really seems to be a big piece, right? So can you talk a little bit more about trust?
Yeah, when I go out and I find a primary care provider for myself, it's all about, do I trust this person and do I like this person? Because you're going to be seeing this person, hopefully not often, but enough, right, to talk about issues that come up. So I believe trust and likability are huge. Those have to factor in when deciding who you should see and how often you should see them, and can they care for all your needs, correct?
Right. I mean, too many times I think we, or I should say, not that we think, but it's dictated by insurance companies. Who does my insurance cover? And that's where they ask you to start. And then you're trying to navigate whether I trust this person or not. So I get a list, and now I have to, go down that list to try to figure this out. But I think the point, I guess, we're trying to make is that please do that. Please go down that list, and please, meet with the different people if you're being driven by the insurance company, so that you find that provider that you can partner with and build that trust and relationship with. Because from our provider's perspective, we want to build that relationship with our patients.
I agree 100%. And I believe that a good resource actually is to call your insurance company. There's a number on the back of most cards, and ask them, how do I find a primary care provider, and what offices can I go to? Because you don't ever want to go into a situation where you go to an office, you really like somebody, and then you find out your insurance doesn't cover it. So finding a primary care provider is based on trust. It's based on location. It's based on, does your insurance cover that person? Because I know you and I, if you live in a certain area, you may not want to go to the local clinic that's there. You may want to go to a clinic that's 50 miles away, or a big academia center, right? But it's harder to get into those places. So I think a great resource is actually calling the number on the back of an insurance card and say, hey, where can I find a primary care provider? I want to make sure that my insurance covers them. And so that's something I've done. I don't know if you've ran into that, where you tell your patients, like, hey, when we were in hospital medicine, right, you need to follow up with a primary care provider. And they're like, I don't even know what a primary care provider is. Where do I find them? I think it's a great resource of, whether it be word of mouth or Googling primary care providers, or checking the back of your insurance. I think those three things can be great resources to help somebody find a primary care provider.
That is that first step, I guess, is that you can Google, you can word of mouth, you can insurance, and then that next step is making sure that you trust that person and can build an ongoing relationship with that person. Again, it's the patient-provider relationship that we talk about in school, right? It's very interesting when I think about what I'm taught in school, and then what I'm hoping my patient experiences when we're in, the office, trying to meet our patients' goals and needs, right? And so I just want to make sure that I'm meeting these patient needs, that the trust is there, where I can trust the patient can trust me, and we're meeting those needs. So I guess then the follow-up to that, though, is I need my patients to be able to freely advocate for themselves. And, what does patient advocacy mean? Jack?
Yeah, no, that's a great thing that you brought up, Jonathan. Advocating goes both ways. In my expert opinion, I have to advocate for my patients, right? Whether it be talking to a surgeon or somebody else, I have to advocate for them. But also the patients need to advocate for themselves, right? And I know that's hard to do. But I always tell everybody when they come into my clinic and see me, I tell them, you're the boss. I'm just the guy here that's giving you the ingredients, so to speak, for a recipe, but you're the boss. You can tell me no. And that's okay. And so I think that's how that builds trust.
And should be done, right? I guess the thing is they should, I'm hoping that patient does tell me no, because then they feel comfortable in those situations. So, sorry, I just wanted to put that point in there that, not only can they tell me no, but I hope they do tell me no if they feel that that's what is in their best interest, right? So, sorry.
Yeah, no, and they should feel comfortable saying no, right? I think we're taught that, and this goes back years, right? When you went to the doctor and the doctor told you something, you just did it. And times have changed. A lot of people don't align with Western medicine, right? So our viewers need to be comfortable when they find a primary care provider that they like and that they trust. Then it's looking at advocacy, advocating for yourself. What medications, what immunizations are they telling you need or don't need? And then preventative type care. So, and again, you can say yes or no to all of that, right? We have the ability, so to speak, to say yes or no to medical care and treatment options.
Right. And it goes to something that we started learning more and more about over, I think, in my personal experience, so at least over the past 10 years, where we focus on making the relationship less paternalistic, meaning less where the provider tells the patient what to do, but more of this partnership together. I provide you, my patient, with the best recommendation that I have based off of the information that you've given me. And then it's a conversation, now that I've given you this information or this recommendation, what would you like to do with that information? Or, what's the next step? Would you like to further talk about it? Are you okay with that treatment recommendation? Or, do you just not want to do that? Sometimes something that I think that's super easy, like, I prescribe a pill and my patient says, I'm not going to take that because I want a liquid. Right. And, it's good for us to be able to talk through that and be able to, something as small as that is still important for my patients to be able to advocate for themselves, because if they need a liquid to be able to take the medication, then I want to give them a liquid to take the medication. Right.
Yeah.
So, it's important to have that, back and forth relationship, making sure that we're meeting those needs, but then also the patients are communicating those needs to us.
100%. There needs to be patient buy-in, right? And what do I mean by patient buy-in is if I tell you you have to do something, you have to believe me and trust me that I'm making the right decision for you to be able to then do that, right? And I'm glad you brought up the fact that maybe a patient can't take a pill and needs to take a liquid. Those are things that build trust. Those are things that patients should bring up to their primary care provider of, yeah, I'll take this medication, but I can't swallow a big pill. I need to have it in liquid. And so it's very collaborative, right? We have to collaborate with our patients. We need to know and understand what they can and can't do and what they want and don't want to do, right? So I think that's super important.
Well, and that's where that partnership comes from. And I think that's why I speak so much about the partnership collaboration, is because I want that to be a collaboration, a partnership with my patients. And so as we've spoken, that is only built on trust, and that's only built on time and time again meeting my patient's needs and then learning more and more about those patients. The beauty of being in primary care is that ongoing relationship is there, so that then that person knows, oh, remember that time last year when you weren't feeling so well? It was was it the time of year, and what did we do at that time to help you? Was it that you got into the gym more? Is that what got you out of, this seasonal funk, if you will? And it's only through those ongoing relationships and that seeing the person over and over that you get to see those patterns, and you get to build that trust and help those patients to navigate those patterns, right? Like it's so cool to be able to be with a patient and just realize that you don't need to do anything big. That, hey, this patient had this struggle last year. They got into the gym. They got better. That's so much better than starting from the beginning, throwing medications and just starting over from scratch. So again, plug for primary care is the need trust. And in that trust, it's being able to advocate for yourself.
Thank you for joining us on today's episode of The Clinical Compass. We are excited to help educate our viewers as we move forward through this series. Be sure to stick around for the credits for a segment called Before You Go, where Jonathan shares one of his favorite pieces of health advice.
Before you go, we're gonna share with you a technique for helping with relaxation. It can be used like before going on a plane ride. So it's called 4 square or box breathing. The 4 means 4 seconds, and box or square is how the technique is, I don't know, explained. So here we go. The beginning part is breathing in through your nose. You're gonna hold for 4 seconds, out through your mouth for 4 seconds, hold for 4 seconds. And again, in through your nose for 4 seconds, hold for 4 seconds, out your mouth for 4 seconds, and then hold for 4 seconds. Key with this is that we're gonna need to do this for approximately 5 minutes at a time to really get the full effects of the box breathing and helping your body to get back to a relaxed state.